Thank you. It's a pleasure to be here. A great group of people. So the theme that we've heard repeatedly here is this importance of looking at the basic biology of aging and to call upon it for novel insights into age-related disease, including metabolic disorders. So what I'm going to do is give you just a very quick look at the inside of a biotech company formed just in the last couple of years, AgeX. So how do we look at all this last several decades of research done by NIA-funded research and in the industry, and then apply that to some metabolic applications? We're a public company. Please find our filings with SEC, who's probably not represented here today. Okay. So,
but there may be an SEC whistleblower in the room. Whistleblowers are all over this city now.
That's why I showed the forward-looking statements. So, all right. So, how do we look at this process? You know, and you know, in biotech, there's a lot of pressure on us because we're not yet profitable. We're development stage companies. We've really got to get at mechanisms that are actionable, right? So. So what we did is we looked at the span of life, and an important piece of biology that I always thought was very insightful is that I think was mentioned here in one of the talks yesterday. There is an immortal substratum to life. We keep making babies generation after generation, which is a reflection of human cells and their lack of aging, and that we continue to perpetuate life. That's what I'm showing you here in this red unrestricted immortal germline, immortal meaning capable of proliferating forever. So but what we've learned over the last few decades is that there's in somatic cells that branch off to make the body, there's a sort of a stair-step progressive loss of that immortal regenerative potential. And the first, I'm just showing you two of the steps here. And the first step is very early in development. Cells that go into the body turn off a gene called telomerase. We heard it mentioned yesterday. So somatic cells in general lack this enzyme, and then so every time cells replicate, telomeres shorten the ends of the DNA strands, and this leads to this Hayflick phenomenon that Richard Hodis discussed yesterday. And then the second step, which is I want to focus on here, because I think the second step probably relates to age-related metabolic changes in a profound way, and I just want to quickly show you a couple of data points on this. So at about 8 weeks of development after the body's formed, by the way, notice these are changes I'm talking about that aren't occurring late in life. They're changes that are occurring very early in life with late life consequences. Counterintuitive, right? What's going on there? The model we have in aging research is we talk about antagonistic pleiotropy. We believe that nature selects for changes, in many cases very early in life, and that benefits the organism early in life, but is detrimental to the organism late in life. The benefit to the early organism is commonly to prevent cancer. So telomerase, we think, is turned off, and it helps prevent cancer because telomerase gets re-expressed in the majority of cancers. Anyway, second restriction, somatic restriction, occurs after about 8 weeks of development when the body's formed. And this is about the time when we lose a really profound regenerative potential that primitive organisms have and we had early in development. So if you cut the skin of a person at 8 weeks of development in utero, within 72 hours the wound is healed scarlessly, and accessory sweat glands and hair follicles and everything all regenerate flawlessly. After 8 weeks you begin to see scarring. The heart can regenerate early in development. If you have a heart attack early in development, the heart just regenerates. We, of course, as adults, we lose that potential. So we've been really interested in focusing in around that embryonic fetal transition. In 10,000-foot view, Otto Warburg years ago pointed out that early embryonic tissues tend to use glycolysis more, so I'm showing you underneath there, and then as tissues mature into adulthood, we shift more towards oxidative phosphorylation, and then in cancer, we shift back to this embryonic mode again. And that's consistent with this antagonistic pleiotropy. So one of the themes you see in modern biotech and indeed academic research is highly collaborative efforts. Sitting to my right is Alex Zavrankov with in silico medicine, who will speak after me. He helped us, his group helped us with artificial intelligence algorithms, and some of the work I'm going to show you here is a result of a collaboration with Alex and his group. You like it when I give he always says thank you. Thank you. So
you're stealing my intro of Alex, though.
Very well deserved. So anyway, so now what am I showing you here? So at the top left is this time scale that I just described. On the far left, ES cells. These are embryonic stem cells. These are the pluripotent cells that are at the day 6 of human development. Diverse EPs. These are different kinds of cells that are differentiated, fully differentiated in many cases, but are pre-embryonic fetal transition. They were made from embryonic stem cells. And then the diverse normal somatic cells are their counterparts and then other cell types that are from adult or fetal sources. And then I've got epithelium broken out, and then we've got cancers. Now CPT1B, you can see, is expressed prior to the embryonic fetal transition and then shuts off for the most part, with the exception of brown fat, for instance, which I'll touch upon in a minute. And then look how it gets re-expressed back in cancers. This is an example of a gene regulating the glycolytic state. In this case, this is carnitine palmitoyltransferase 1B, involved in fatty acid transport, and key rate-limiting step in that. And then below that, you'll see COX7A1, which is a gene that's regulating the formation of dimers of complex 4. So it sort of supercharges oxidative phosphorylation. And look how, you can see how it's turned on after the embryonic fetal transition in virtually almost every cell type in the body. And then it's conspicuously absent in many cancers. On the bottom right is a marker of aging. This is a clustered protocadherin marker, GA12. Now on the top, I just point out brown adipocytes there. There's fetal brown adipocytes stained for UCP1, this marker of these cells. As many of you know, in aging, there's a precipitous loss of brown adipose cells. You'll notice from our gene expression data how they're utilizing fatty acid oxidation and cranking up OXPHOS dramatically. COX7A1 is commonly thought of as a marker of brown fat, in fact. So one of the approaches we take in biotech is to simply manufacture these cells. On the right is brown adipocytes made by us, where it's in a development program for treatment of age-related metabolic dysfunction. These two pathways tend to be reciprocal with the exception of brown fat, so the embryonic pathway is either expressed in cells or the adult pathway. And there's correlates in vivo aging. And so here I have two papers just to point out how this data correlates well with age-related, for instance, muscle frailty. In the case of the little highlighted diagram on the left, you can see that this group noticed that CPT1B is expressed as embryonic. Regenerative marker is expressed more in robust muscle compared to frail muscle in the elderly. And on the right, again, look at frailty in muscle. They see impaired mitochondrial function, and then you'll notice this protocadherin gamma being a marker of dysfunctional and frail muscle. So this is just an example of how a biotech company utilizes novel insights into the central biology of aging, and then can use that to translate it into potential product development in biotech. Yesterday was mentioned one of the more exciting, I think, approaches to intervention in aging, which is literally reversing the aging process using reprogramming factors. You remember David Sinclair spoke about it, Tern spoke about it, and so on. This is an active area of research in our company, and you'll notice on the left is a time course of reprogramming published by Lova et al. And you'll see how COX7A1 turns off very early in the reprogramming process. Some people call this partial reprogramming. We call it induced tissue regeneration. And on the right is an example of a formulation we're developing, and you can see how we can turn back on the CPT1B expression and inhibit COX7A1. So here's a novel therapeutic strategy based on all this biology. That's the end of my slides. Thank you.